Where the Pacific Ocean meets the Northwest United States, members of the Native American community pay tribute to their ancestors who lived solely off their convergence of land and sea. They paddle, working together, like their mothers and fathers before them, to accomplish a joint goal. Today, tribes must work together to make certain all tribal members have a say on issues ranging from land rights to health care. Tribal nations are working together to ensure that families and children can thrive, that they can get the care, education, and jobs they need in their own communities. We are making progress, but dental care remains inaccessible for many of the 567 federally recognized tribes.
The only time you went to the dentist was when you had to go. Had I had some dental care in those early years, I'd have a lot better teeth.
Our preschool-aged children have 4 times the rate of untreated tooth decay as white children. This is unacceptable. Like those before us, we are not waiting any longer for another decades-old program to change. We are taking the issue in our own hands, changing how dental care is delivered in Indian country and across the states, with the hiring of dental therapists.
I get people out of pain, or I don't want them to feel the pain. So if I could fix their tooth or teeth before it gets bad, then I feel pretty good about it.
Wow. Oh, look, he did a great job.
These are our people that are going away to get trained, and they're coming back and they're working with families, they're working with young parents, they're working with young children.
We have a waiting list that's almost 2 months long, and by allowing a dental therapist to come in and take care of some of those lower level needs, this again frees me up so I can take care of those root canals or swollen teeth and complicated extractions. Having Mr. Kennedy here, that is our dental therapist, has been very, very advantageous.
You're bringing someone from the community, educating them, and then bringing them back so that they can provide care for their own community. His first patient was a 4-year-old boy that came in and jumped into his chair, and usually it takes a provider, an outsider that comes in anywhere from 3 to 5 years to really start to build a relationship with the community. In this case, this little guy jumped right up and he looked into Daniel's eyes and he could see himself and he instantly felt comfortable. The therapy program is a native solution to a native problem. So we all get to work at the very top of our scope. We all get to be excellent clinicians and practice to the best of our ability, and it makes it much more efficient, much better for the patient because they get through their treatment plans a lot faster, and then they get to have some higher quality dentistry that oftentimes our native communities aren't getting to see, and hopefully they don't lose any more teeth for the rest of their life.
If you look at the history of dental care in Indian country, it has been very abysmal. The federal government has failed in their responsibility to provide adequate dental care to our people, and as a result, generations of tribal members have the highest rates of cavities than any other segment of society. Our children are getting cavities at a very, very high rate, and we're looking for other tribes to follow our lead, to follow Alaska's lead in making sure that our children's dental needs, our teenagers' dental needs, and our adults, our seniors' dental needs are taken care of adequately.
There'll be a time when we are doing much more prevention than we are treatment.
Because you're bringing someone from the community, educating them, and then bringing them back so that they can provide care for their own community.
I saw what I felt was the future of what dentistry should look like.
The best part I like about this job is teaching people how to take care of their, actually not just their teeth, their whole mouth. So these kids that are learning how to floss, they have a very high chance of growing up of being cavity-free.
We hope to work together with the government and other agencies to bring about better health, dental health.
We are showing our children and our grandchildren what true sovereignty in action is.